stress doesn't discriminate. So the way in which you process mental stress, emotional stress, financial stress, environmental stress, those are all the exact same. Okay, the body has very simple mechanisms. You mentioned a lot of them as to how it responds to stress, right? Through hormone shift, cortisol, and through change to our physiology, right? When we're in a sympathetic state, we prepare ourselves for trauma. We prepare ourselves to fight. We prepare ourselves to flee. But one of the other mechanisms, so we understand a lot of that, how it shuts digestion down, how it opens up and dilates the pupils so that we can react, more quickly, how it shunts blood away from the extremities. All of those things are mechanisms, for this fight or flight. But the mechanism that very few people look at and understand is that there is direct global communication with our fascia system. And our fascia system is a network of tissue that is right below the skin. It's on the periosteum of the bone. It surrounds every muscle fascicle. It surrounds all of our organs. It actually comprises of our nerve fibers. It is everywhere throughout our body. And we always have learned about fascia as just being like connective tissue. But the fascia is actually being now looked at as a system of communication, that it is the largest organ in the body. And it is actually communicating with the autonomic nervous system bidirectionally.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode. All right, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Doug Bertram, and we're going to be talking a lot about stress and some of the good things about it, believe it or not, and the structural elements of the human body. But first, I'd like to invite you to visit my website, theexplodinghuman.com. Over there, you can listen to episodes, read synopses, see photos of my guests, a little bio on myself. There's a donate button if you'd like to support the show through Patreon. Thank you very much. There's also a YouTube channel where you can listen. That is The Exploding Human with Bob Nickman, and The Exploding Human Facebook page. As I said, my guest today is Doug Bertram. He has been involved in acupuncture and physical manipulation of the body in various forms for over 27 years. He has a clinic called Structural Elements. There's actually 3 brick-and-mortar clinics, and we're going to talk about his app, which helps people to realign their body for self-healing. And we're also going to talk about stress, meditation, all kinds of cool stuff that have to do with how we move through the world and how we deal with our bodies. This episode is very practical and informative. Doug's a great guy, and we had a good time doing this, so here he is. This is Doug Bertram. The first thing that fascinated me about this was the idea of using stress to your advantage, because as I was saying before we started talking on the recording was that, my attitude about stress is that it's bad and you need to make it go away. And your attitude is a little bit different, which I found actually very informative. And I think I may be swinging toward how to use stress, because it's inevitable, to our advantage.
Yeah, stress is a fascinating thing. And I think when you hear stress, it's automatically seen as a negative, I'm feeling so stressed. But, we kind of focus on performance and work life and sport. And in order to perform in those things, you need stress. I mean, stress is critical to our survival. It's how we, react to a threat. It's how we, how our immune system builds. It's how we get stronger, right? But even mentally stimulating, you need the stress of a math test to really process and maximize your understanding of information. However, reacting to that stress in the correct proportion to the demand of our situation is what becomes imperative to whether stress is an advantage or whether stress has starts to build and become a negative force in our lives. And so that's the key is how do we regulate in response to the demand of our situation.
Yeah, so there's obviously various levels of stress, and then we talk about like post-traumatic stress. So traumatic stress, not very healthy, but a certain level of I always kind of looked at stress in some ways as it just means you care. And how much do you need to care, and in what way to use it to your advantage?
Well, stress is also how we signal to the body according to what sort of response we need the body to create. And even, you know, let me, I love this example because I think it's really clear. You know, with 2 seconds left on the shot clock, right, and you're at the free throw line, and you've got the game winning, shot in your hand. You don't say, "Hey, time out. I'm going to go to half court and meditate." Right? I mean, you have to get it together, right? You have to center yourself. You have to like find within you how to take the situation seriously and to focus, and then you take the shot. And so the that's healthy stress. Okay, it's stress that gives you the feeling of, okay, this matters right now. I have to perform. Where stress becomes detrimental is when we're not taking the game-winning shot, but we don't shift our nervous system down to a recuperative place. So the autonomic nervous system, put very simply, is broken into, the fight or flight and the rest and digest. Okay, so the sympathetic drive is a really important thing to react to a situation. But if we stay in that sympathetic drive when we're in a low demand situation, when we're trying to have dinner with our family and we're trying to get a good night's rest, if we're stressing about having to take that game winning shot, next week, we're not spending that time to recuperate and to heal our bodies. And so the appropriate response is what determines whether stress is your ally or whether it's something that's detrimental to your health.
Well, that's an interesting scenario, which I totally get that. That's a great, but the idea of like sitting down, when you say sitting down with your family, having dinner, and you're stressing about what? It's the future. So there's the mental component. There's obviously like a real threat, fight or flight, something's happening. I need to be in a heightened state. My adrenals are firing, cortisol is happening, all that stuff works great in those situations. But then you have this mental piece of, oh, I have a big meeting next week, and there's something I want, and I hope I do it the right way. And you start going over all these
Sure.
things, and you create stress in your mind between your ears when nothing is actually happening.
Yeah, so I love that you gave that example because I think there's actually one process removed that is even more important, is the fact that stress doesn't discriminate. So the way in which you process mental stress, emotional stress, financial stress, environmental stress, those are all the exact same. Okay, the body has very simple mechanisms. You mentioned a lot of them as to how it responds to stress, right? Through hormone shift, cortisol, and through change to our physiology, right? When we're in a sympathetic state, we prepare ourselves for trauma. We prepare ourselves to fight. We prepare ourselves to flee. But one of the other mechanisms, so we understand a lot of that, how it shuts digestion down, how it opens up and dilates the pupils so that we can react, more quickly, how it shunts blood away from the extremities. All of those things are mechanisms, for this fight or flight. But the mechanism that very few people look at and understand is that there is direct global communication with our fascia system. And our fascia system is a network of tissue that is right below the skin. It's on the periosteum of the bone. It surrounds every muscle fascicle. It surrounds all of our organs. It actually comprises of our nerve fibers. It is everywhere throughout our body. And we always have learned about fascia as just being like connective tissue. But the fascia is actually being now looked at as a system of communication, that it's the largest organ in the body, and it is actually communicating with the autonomic nervous system bidirectionally. So when we're in a stress state, it stiffens our fascia. Okay. Sometimes people get so stressed that it causes almost paralysis. They freeze. because of the stress. And that is the direct stiffness of our connective tissue. But it also works in the opposite direction. If we're over stiff, okay, we're telling the nervous system that we're stressed. And that also turns on that same system. So the autonomic nervous system is constantly looking to answer one simple question, and that's, am I safe? And if the answer to that question is no, we are in a sympathetic drive. If that answer is yes, then we get into a parasympathetic shift. So a lot of what we focus on in terms of mechanistically being able to identify your stress level and then to have some sort of control mechanisms to bring yourself back in to an appropriate response is through the awareness of how much tension you're holding in your body. Right? Because we don't really know what our cortisol levels are. We don't really, know, how much blood is flowing to our extremities, but we can feel how tight and stiff we're holding our bodies. And that becomes a real mechanism to understand whether our stress response is appropriate or whether it's excessive.
That's a really fascinating idea that the how do you say it? Fascia? Is that how you pronounce it?
Yeah.
Fascia. Yeah. I always heard fascia and I heard it wrong.
Yeah.
So
oftentimes fascia is so it's spelled the exact same, but when we talk about it in terms of a surface on a roof line, a lot of times it's pronounced fascia, but fascia is more the traditional pronunciation when we're talking about human connective tissue.
Well, that's really interesting that you described it as the largest organ in the body, or because the skin also being an organ, the outward part of the skin, but this is underneath. So it makes complete sense that those messages would be sent throughout the entire body, and then everything is going to be affected.
Yeah, and it's at the speed of light. So it's not that it is like, okay, I'm tight in my shoulders because I'm stressed and I've tightened my muscles, and now those tight muscles are leading to some sort of change in the connective tissue, and that's not pulling in my back. It's at the speed of light. They're signaling that is the fascia is listening and is deeply connected all at once. So I study Chinese medicine. We talk a lot about energy in the body, right? If the energy is blocked, that's bad. If the energy is flowing, that's good. But I'm a Midwest boy, so this never really sat with me. I'm like, okay, this energy, but like, what is it? I always wanted to put my hand on it and be able to measure it. And so instead of thinking about this chi flow throughout the body, as soon as I thought of it in terms of communication versus chi flow, it made a lot more sense. So healthy flow throughout the body means that the body is able to communicate with itself. And so if my toe knows what's happening in my ear, well, that's a good thing. Okay. And mechanistically, how that happens is through the fascia. The fascia is full of signaling mechanisms that are on the brain map. And we are self-aware through all of the communication happening throughout our fascia system. And if we lose that communication through either disruption in the continuity of that tissue from an injury or from an illness, from inflammation, or if it's so tight that we're adhered and there's an area that is not being able to respond to movement, all of that is loss of communication. And so, the more that, the more members of the team that are offline and not able to communicate, we're going to be less productive as a system. So it's really the central mechanism of how we alert ourselves and gain self-awareness of the state of stress that we're in.
So when you're treating people, I guess you're a clinician, an acupuncturist, and what else are you? You're
manual therapy. I mean, I've been a myofascial therapist for close to 30 years now.
Okay. When you're treating people, what are you're using acupuncture? Are you using body work with your hands? Are you using electrical stimulation? And what about the meditative piece, if there is one?
Sure. Yeah, no, it's all there. So yeah, acupuncture is a great tool. It has nothing to do with the poke. It has to do with the twist of the needle. And when you wind the collagen fibers of the fascia around the needle, you actually stimulate a release of additional fluid that helps improve its elasticity and movement. So it's a great mechanism for relaxing the tissue. It's what you do with that relaxed tissue that makes the difference long term. So we do soft tissue integration, where we will pin tissue down and then facilitate active range of motion to help realign those fibers. We do some manipulation of changing where the osteostructure sits, so lining up the pelvis, lining up the spine, making sure the small joints are moving properly. We prescribe exercise and stretching to help people continue to keep the mobility and to focus a lot on posture and postural shift. So there's a whole bunch of different factors that really play into keeping somebody well, but again, a lot of it comes through helping them improve their awareness of, man, I didn't even know that was tight, right? Yeah, it is tight. Okay. And so, yeah, you're coming in for low back pain, but maybe the problem is that your quads are completely, full of adhesive tissue because of overworking just that area and not another one. Or it might realize that, oh, my head is really far forward because I really need glasses so that I stop putting my face so close to my computer, and that tightness is that what actually is leading to some low back pain, or even some some foot pain even. So we don't treat just like the site of pain. We really look at balancing the entire structure of the body. And one of the benefits of good posture and relaxed connective tissue is it helps the sympathetic and parasympathetic regulate. So it all gets back to that mechanism, right? Which is, again, allowing us to have fluidity of controlling our stress response so that we don't get the accumulation of chronic stress where we're in that sympathetic state, even though we're in a low demand situation.
I'm always fascinated by what makes me stressed. You probably see some very common things that when people come, I'm stressed about money is a big one for people. I'm stressed about my relationship. I'm stressed about,
time is a big one.
Time is the biggest one. Yeah, that was going to be my next one.
Yeah.
I don't have enough time to do all the stuff I quote need to do.
Right. Exactly. Yep.
And it's sort of this artificial construct, the idea of, time, there's clocks and all that measurement of time. But, if you ever talk to an insurance salesman, time stands still and you want to kill yourself. You know what I'm saying? Time is sort of relative to what we decide it is and what we make it, and how important the importance we place on things.
Yeah. Yeah. But that, again, comes down to an experience of time, right? And oftentimes the experience of time is things are either moving slower than we want them to, or they feel like they're moving quicker than we want them to. And that's in relation to where we're kind of harmonizing with it, right? So, if we are really ramped up in a sympathetic state, and then you put us into, sometimes I have patients that come in, and most people sit with the needles for about 20 minutes. Okay. And some people are like, oh my goodness, I thought you forgot about me. What am I supposed to do in here for that? Next time, can I have my phone, or can I, it's like, that's just agonizing, right? To sit there for 20 minutes in quiet. And then I have people that I come in and they go, oh, are you back already? I was just really starting to relax. I could sleep here all day. This is wonderful. That was the first time I've stopped moving. And, so it's the same 20 minutes. It's the exact same process, but depending upon how wound up or how well somebody's able to shift gears, that experience can be completely different. And those same patients that that start off, oh, I thought you forgot about me, what am I supposed to do in here for 20 whole minutes, become the patients that say, oh, that was amazing, I feel so relaxed, I think I finally fell asleep for a while.
I actually just had a memory of, I actually did get forgotten about once in an acupuncture, and I was and I couldn't move because the needles were in a place that I couldn't move. And I'm like yelling at the thing, hello.
Yeah, that's
she's like, I'm sorry, I did forget about you.
That doesn't happen at Structural Elements, I can assure you that. So.
I completely forgot about that till you mentioned it. But yeah, it's that's why I love meditation, because I every time I start out meditating, it feels like I can't do it.
Mm-hmm.
And my mind is racing, and I'm thinking like, I can't wait till this is over so I can get to the important stuff. and then
Right.
and then after a little while, I start to feel it all, I give myself permission to have the time
Yeah,
ahead of
absolutely.
time, which helps. And then I'm in it, and then I don't even want to come back. It's like,
I actually went to a Buddhist college in Boulder, Colorado, named Naropa University for my undergraduate studies, and did a lot of meditation as part of the curriculum there. And admittedly, it was like sometime like pretty late into the second year of like doing this stuff really regularly that I started to realize that the point of meditation is not toughness training. I thought the whole idea was like to be able to endure being uncomfortable, right? And then I started realizing, wait a minute, that's not it at all, right? It's actually to experience comfort and peace and calm and relaxation. That it wasn't, because what a lot of people don't realize is like, both with yoga and with meditation, posture is so important in terms of being able to facilitate a relaxed nervous system experience. And so if you're not with your breath, and if you're not able to achieve relaxation, you're just putting yourself in funny shapes. If you're not doing the breath. And most people with seated meditation, their hips are so tight that they actually can't get their spine into a neutral position where they're able to relax their nervous system. And the breath is so important in terms of the actual, when we exhale, it stimulates our vagus nerve, which directly stimulates the parasympathetic response. So a lot of breathing techniques, to help get into that more calm, receptive state, really are directly physiologic in terms of their response. And we can't outpace our anxiety with calming thoughts. We have to bring our physiology along for the ride. And how we shift that physiology is through posture and through proper breathing.
yeah, I cannot sit and meditate.
No.
Because of the hip thing. It's
Yeah.
just, I'm like, why would I do this? And they,
Yeah.
put a pillow under there so it takes the stress off your hip flexors and all that stuff. And I'm like, no, I'm going to lay down.
Yeah,
That's what
exactly.
I do. I
Yeah.
don't have to win any awards for
No, no,
looking like a
no.
Buddha.
So I totally agree, and there's actually studies that show this, that a laying down position can actually help people drop into a meditative state quicker than a seated position. But we give everybody what we call the traction position in our practice. It's like structural elements 101, and it's laying flat on your back with your knees bent, your arms out to your sides, palms face up, and doing deep diaphragmatic breathing for 3 minutes a day. And what it does is, yes, it helps your posture because it takes, some of the abnormal curvature out of your spine, and it opens up the front of your shoulders so that you're not rolled in. But what it also does is it sets the autonomic nervous system up for better regulation. So both by having the thoracic spine supported, which is where the sympathetic is all regulated, and by having the knees bent with your sacrum, flat, and your chin tucked with your occiput open, that helps stimulate the parasympathetic. So, and then the breath is the mechanism to toggle between the two of them. So laying in this just takes no money, takes just a flat surface. You can do it just about anywhere. And for 3 minutes a day, if you actually do it, it's life changing. And knowing about it, I found is helpful, but actually doing it is still required.
Yeah, you got to have the action to back it up. Now, when you said knees bent, you're saying the feet are flat on the floor?
Feet are flat on the floor.
So the knees are up in the air.
So yeah, the knees are bent, up, and then the feet are flat. And that what that does is if you're laying on your back with your legs extended because of the tightness that most people hold in their hip flexors, you're still going to arch the low back. And when you arch the low back, it's going to be harder for you to tuck the chin. And so those two things will make it harder for the parasympathetic system to kick in and harder to get a full diaphragmatic breath. So the diaphragm attaches right on the front of the spine at the same place that the hip flexors attach. And so there's a big junction of tissue there right at the core of the diaphragm. And so if you take that pressure off the hip flexors by having the knees bent, it'll make it for easier diaphragmatic engagement.
And talk about the breathing in that position, because I'm very confused, and I always have been, with exercise breathing and meditative breathing. in through the nose, out through the nose, in through the nose, out through the mouth. I've done breath work, which is all mouth. It's very confusing to me, and I guess there's
Yeah,
different types of breathing for different effects. What?
there's tons of different types of breathing, but there is something true about, like, in some practices they call it like Ujjayi breathing, or just simple nasal breathing alone restricts the intake of air between our mouth, right? And when we restrict that intake of air, we slow the breathing down, and so that resistance on the inhale also has a calming effect, and and it can stimulate the parasympathetic response quicker. So there's different techniques, but for me that's like 303 level. So 101 level is just like lay flat on your back and breathe. The thing that I would focus on more so than in through the nose or out through the mouth, or even the length of breath, is just when, as you inhale, try to push the abdomen up towards the ceiling to ensure that you're getting that diaphragmatic engagement. And as you exhale, let it all relax. And so
Mhm.
that, as you're breathing in, you should see some raising of the abdomen to make sure that you're not staying shallow with your chest breath, but that you're actually getting diaphragmatic breathing to happen, because it is that diaphragmatic breath that really controls and helps to regulate that parasympathetic engagement.
But you're breathing in and out through the nose in this 3 minute.
Yeah, I mean, I breathe in through the nose and out through the mouth.
Oh, you
Is
do?
is
Okay.
the technique that I personally use. Yeah,
Okay. So there's no right way to do a lot of this stuff. It's kind of what works.
yeah.
I mean, I always kind of look at myself as a little bit of a test tube, and I'll take instruction and I'll try it, and if it works, I keep doing it, and if it doesn't, I'll play around with it a little bit.
Manipulate
And
it until it does work for you. Yeah,
yeah,
right.
exactly.
There is, again, just while we're on the topic, there is one little mechanism that can be helpful as well, and that is the length of the inhale versus the length of the outhale or exhale. So there's something called heart rate variability, and a higher heart rate variability is a better number, is a better score in terms of being an indicator as to how well we're regulating our stress response. And the numbers, the variability, is how fast is my heart beating when I inhale versus how fast is my heart beating when I exhale. And on exhale, the heart should slow down. Okay. If you have a high heart rate variability number, it means that the difference between the inhale and the exhale is greater, and that is a good thing, right? If the numbers are staying the same, where my variability might only be, 4 or something like that, well, that means that I'm not getting parasympathetic breakthrough. And it means that, my heart rate is not coming down and changing with the inhale and the exhale. So we want to try to make that number bigger. And one of the ways to make that number bigger is to exhale longer than we're inhaling. So if we breathe in for a four count, try to exhale for a 6 count. And just manipulating that can really start to get that parasympathetic breakthrough and increase our heart rate variability score.
Another great thing I've just learned. I always
There
wondered
also,
why they would say, hold your breath for, bring it in for 4, hold it for 4, let it out for 4, and then
yeah,
lengthen certain things.
yeah,
Okay, that's
that's what it
the
does mechanistically. Is it's helping regulate that stress response, and so that's the name of the game, to get into all the good stuff. When we're in that parasympathetic state, our tissue is repairing, we're digesting better. Our nervous system is calm. We're getting better blood flow out to the extremities. The pupils constrict a little bit, so we're not getting as much light flow in, and it just is really where the body can go into a more restorative state.
talk about your a little bit about your practice and the app that you have and some of the ways people can find you and maybe work with you or do some of the things that you're talking about.
Yeah, so we Structural Elements is the name of our company, and Structural Elements has 3 brick and mortar clinics, 2 in Maryland and 1 in Wisconsin. I know that's a little bit of an outlier, but I grew up there, and some guys that I practiced with took over that practice. But outside of our brick and mortar clinics, we are actually a franchise. So if people want to open up a structural elements clinic. We can tell you where the light switches go and what all the paint colors would be. But we realized that, we're not gonna reach everybody just through brick and mortar. So we've started 2 subscriptions. One is called SE Network Provider, which means that a therapist can benefit from the education of how we practice in structural elements, as well as all of our business templates and tools of running a cash-based practice. And that's all available for a subscription called SE Network Provider. But then on the patient side, we developed an app that's live in the iOS and Android store. It's called SE Lab, and Lab stands for Learn and Apply Balance. So learn the awareness that we're holding stress, learn the awareness of what stress feels like, learn the awareness of the roles that stress play, apply the right tools at the right times to achieve balance. So learn and apply balance, SE Lab. And again, these are, sometimes people are like, well, it's not very intuitive, like, because I thought this was about stress, but then I get on there and there's like, you're telling us stuff about like how to roll out connective tissue and massage techniques, for relaxing the calves and, and postural stuff. Like, how does that relate to stress? And what I'm telling you is that is how you regulate the stress response. You have to treat the fascia. You have to reduce the stiffness in the body and get that communication back online. It's one of the big mechanisms. And that traction exercise that I just talked about, that laying flat on your back, that lives outside of the paywall. So there's no, it's only $11 a month anyways for the subscription, but you go on, you download that app, and the instruction for the traction is free. That's our gift to the world. We think that the world's a better place if everybody could take 3 minutes a day to regulate their stress response. So that one's on us.
I have one spot on my body. I'm going to get personal here.
Sure.
My right hip flexor has been bugging me. I was told, and this did improve, that I had weak muscles in my lower back. So I've been doing a lot of bridge positions with raising my leg, and it's helped quite a bit. It's probably improved 75%, but I still have a little bit there on one side, and I'm not sure what to do about it, other than I really don't want to go to a practitioner often. That doesn't interest me. I really like to figure it out myself. I'm doing yoga, which is helping a little bit. But there's just, I don't know, maybe it's because I'd like to say, oh, you're 68, if you're going to have stuff, but I don't believe that. I really think that either. Yeah. So I really think that there's something I'm doing or not doing that is giving me this issue, and it isn't major. It's not affecting my life. It's mildly annoying, but it wasn't there a year ago.
Sure. Well, let me say this, is that the pelvis is actually quite mobile, and the integrity of the pelvis and the stability comes from the muscles that surround it. Okay, so we often found ourselves to be hip flexor dominant because the psoas muscle is a big, thick, ropey muscle that crosses the front of the hip. And it's an opportunistic shortener. So if you leave it in a short position, it's going to clamp down. And when we sit, it's in a shortened position. The muscle that helps to counter it is the glute muscles in the back of the hip. And those muscles are in a stretched position when we sit. So a lot of it is just about, trying to get the front of the hip to relax and the back of the hip to strengthen a little bit to restore that muscular tension. You can get rotations to the pelvis, where something called like an innominate rotation, where one side tips forward compared to the other. That's a lot of what we correct in our practice, are those pelvic distortions. There are some what we call rescue moves for the pelvis. I can send you a link after the show here, but then they are included on the app as well. But one exercise we call windshield wipers, which is basically putting the feet wider than the hips and dropping the knees from side to side, like windshield wipers on a car. And that does a really nice job of restoring some of the mobility back into the sacroiliac joints, and helps to kind of realign the hips, as well as single knee to chest type motions. They get the pelvis to start tractioning a little better. And then there's one on the app that I love called the donkey kick, which you take a massage ball of some kind. I used to use something around 5 inches, the size of a softball, and you stick it right in the front of that hip flexor, and at the same time pressing that same foot towards the ceiling. So you're engaging the glute at the same time that you're relaxing the hip flexor, and it does a really nice reset. So there's simple techniques like that don't require necessarily, a lengthy process and even being seen by a practitioner, but can really help maintain and restore that muscular balance in the pelvis and bring a lot of relief.
I love that because I had to have some physical therapy for some calcium buildup in my shoulder. And the guy goes, well, I can help you with this, which he did. He goes, but here, you got to do these exercises. And he goes, no one does them. And so they come back. So I go, well, I'm going to be one of those people that do them. So I've been doing them for years, and they're very simple. It doesn't take very long, and I haven't had to go back to the guy.
Yeah,
which
that's the key, right? I use this analogy a lot too. Is you can have 100-year-old home, and the hinges on the front door open and close perfectly after 100 years, right? Because the forces are evenly distributed. Now, if you had a little settling to the foundation of the house, and all of a sudden you're putting an unequal load on those hinges, they're going to rip out of the door jamb, within a couple of times of slamming the door. And so, it's all about keeping the load evenly distributed. The name structural elements is really like, because we take an engineering approach to the human body, we really look at the mechanisms, and we think that, I'm going to pause on this comment for 1 second.
Okay.
What system in our body do we not do any preventative diagnosis at all? Right? It's the musculoskeletal system. We don't look at the joints. We don't get evaluated for pre-screening for orthopedics. It's not until something's broke or injured. Okay. And you all of a sudden the hip doesn't move anymore. But we go in for colonoscopies. We go in for EKGs. We go, women go and get their annual, exams and mammograms, and we get regular blood work and everything. So why in the world don't we pre-screen for the health of our knees, the health of our hips, the health of our spine? Like, why isn't this also, a preventative approach? And so we think that's ridiculous. And so the majority of the work that we do with our patients is to try and predict where a joint is experiencing abnormal mechanical forces and try to change those forces before we wear down the joint, right? And so that balancing of the body is not in response to pain. That's not when it's done best. The balancing of the body is when it's done preventatively, And so we treat a lot of young athletes, and we just say, hey, this knee is going to have problems unless we strengthen around it, and unless we, maybe put an orthotic in that foot, or work on strengthening the arches, or, you've got this crazy head forward posture, and that's going to load up the low back and cause all these changes. Let's fix that. And so, that's really the approach that we take, is looking kind of preventatively and mechanistically at how load is distributed throughout the body, and what joints are likely to experience, more taxation than others.
That to me would be the ultimate priority in all medicine, is preventative. And we sort of do it, but not really. It's, like you say, there's those tests, but they're less preventative than they are diagnostic.
Yeah.
And the idea of prevention is and economically it makes more sense.
Absolutely.
I mean, that's been proven economically. If you do preventative, then you save, triple, quadruple the amount of money that you do on the back end with fixing things that are broken.
Yeah, and I do think that there's, at least conceptually, there's more buy-in to that in our medical system. There's more emphasis being placed on value-based healthcare. That you want to keep people well versus treating them when they're already ill or injured. But I think that we're a long way off before we're effectively cutting off otherwise avoidable procedures.
Yeah, I remember the year when my dental plan went from 2 cleanings to 3. So somehow that Delta Dental figured out that it was cheaper for them to do 3 cleanings than it was for me to do 2. And I was like, well, to do
clean
the
more often.
third
Yeah.
cleaning.
Yeah.
Somebody obviously ran numbers and went,
Mhm.
we're going to give people stuff so to save us money in the back. They didn't
Right.
do it out of altruism, that's for
No,
sure.
no, definitely not. No, it's data supported. I promise you that.
So let's talk about the app one more time because I think I'm going to be downloading that app. SE Lab is what it's
Yeah.
called.
Yeah. SE Lab. So SE stands for structural elements, and then Lab is the learn and apply balance. LAB.
Okay. So folks, that's the app you want to get if you want to learn more about this kind of stuff. There's a website, I'm assuming, also
Yeah,
people can.
structuralelements.com is our primary site, and from there, there's information about our clinics. There's information about the franchise opportunities. There's information about the provider networks, and also about the patient facing resources.
So let's say I'm interested in doing something here as a patient and I'm in Los Angeles and I would contact you and you have people that are in your world that you would refer me to?
We do. We have both in our clinics and in our network. So if we have somebody that is in enough proximity to actually go and receive treatment, great. But you can also do a consultation with one of our network providers or the therapist in our clinic and help you walk through, like
Oh,
you gave me a specific situation with your hip, and those providers can help walk through and give you some pointers and maybe direct you to content on the app that would help curate your experience.
I love that. It's like a televisit with
Yeah,
your provider, but you'd be the
exactly.
provider, and then you can actually see what walk. Do you have people like walk towards you and walk
Yeah,
away and
definitely. The
yeah.
during COVID, we really started understanding the power of video. We thought, well, we do so much hands-on work that how would we ever do that, via telemedicine? But it's amazing what you can do just in terms of demonstrating to somebody what the exercises look like and having them show you, as they do them. You can pick up on all kinds of things, but also just watching somebody move an arm and in their shoulder and pointing to where it hurts and all of that. There's quite a bit that can be determined over video, and all of our providers are very well trained to know when they've met their limitations of saying, hey, I don't know, I can't, you need to get into somebody and have them put hands on that, or you need to get in and have that imaged so that we make sure that we're not missing anything. So telemedicine has its limitations, but it's also a great tool, just based on its efficiencies.
I'm always amazed when somebody can look at me and tell me stuff about that I never even, like, oh, your right hand is hanging lower than your left hand and your hip is this way. And I see turn your head. Oh, your neck is, and they know all this stuff about me that you almost feel naked in a way. Like, so
Well,
to go
but
like, how do you know all this shit?
well, and in the same, you ask, well, why was Tiger Woods such a good putter? Well, it's because he did it, all the time. He practiced and he played a lot, right? So, it's like for us, I mean, I've in the 27 years that I've been looking at bodies, you start to see, things that the layperson, maybe not focus on. But when you start looking at, like, it's virtually impossible for me to work out at a gym anymore because I can't turn it off. So all I'm seeing at times, I'm like, oh, I just want to go up to people and pull the plug on the treadmill. I'm like, you should absolutely not be on that thing right now with how shifted your hips are. It's like, but it's like, you can't just walk around giving people, unsolicited medical advice. So
Oh, I know. It would be so tempting. I had a friend whose brother he became a podiatrist, and we were walking one day and he goes, has your right foot always been turned out like that?
yeah,
I'm like, hey man, get away from me.
right. But
And
even
yes,
now,
it has.
my 8-year-old daughter will be at at the fair. We're walking around and Dad, do you have any business cards on you? No, why, honey? Because that woman's hips are out. She needs to come see.
People get mad too. Like,
Right,
quit
right.
looking at me.
Exactly. Yes, we don't solicit. We don't solicit. That's
Yeah. No,
but it is
it's
glaring. It is glaring. You can't turn it off sometimes.
yeah.
So.
Well, I guess that's one of the downsides. Maybe I don't know what it is. It's just Well, thanks so much for talking to me today, Doug. I really appreciate your
My
time,
pleasure.
and folks, get the app and check out the website, and great work. Keep it up. And if I'm ever in Maryland, I'm coming in.
All right. All right. Call ahead.
Uh, no,
Let me
I oh, really? I can't just do a walk in?
know. Well, you might be able to, but
I
that's
might be able
that's
to. All right.
preferential treatment. Don't tell my people on my waiting list though.
Oh, yeah, the waiting list. Fantastic. That's nice to hear you have one. All right. Well, have a fantastic day. I appreciate
All
your
right, you as
time.
well.
Thanks so much, folks, for listening into The Exploding Human. Check out the website, theexplodinghuman.com, the YouTube channel, The Exploding Human with Bob Nickman, and The Exploding Human Facebook page. Again, big thanks to Doug Bertram for being my guest today. Learned a lot. And I'm going to be downloading that app as soon as this episode is over, checking out some of the tools that Structural Elements has to offer. And I hope you guys do too. Have a blessed day. Thank you so much. Bye.